Greetings from Human Biological Institute. Welcome to yet another engaging session on our scientific forum, Immunization Conclave. At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through one of its Immunization Pride. Immunize with Pride is an initiative dedicated to educating the public with vaccines, diseases, and the importance of timely vaccination. These sessions feature leading experts from across the country to share their valuable insights on key health topics, aim to raise awareness and promote overall well-being of the society. Today, we are glad to have Dr. Harmeet Singh and Dr. Srinivas, who was for the moment, please allow me to share a brief introduction. ESEGH Limited, which is a One Health company. IIL was established by National Dairy Development Board (NDDB) in the year 1982 as its unit, and later registered as a company in the year 1999 with the name Indian Immunologicals Limited. HBI was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to roll out first varicose culture rabies vaccine in the year 2000. Subsequently, HBI launched other vaccines, and currently HBI is a major player in the human vaccine segment. HBI is a leader in anti-rabies vaccine segment and also present in around 60 countries. HBI has 3 state-of-the-art manufacturing facilities, which is Ooty, Gachibowli, and the Genome Valley, which is based at Karkapatla. With the vision of shaping global healthcare by spearheading One Health initiative with a mission to innovate, produce, and market quality healthcare products and services to improve and extend life, with the value we believe in providing affordable products with high quality through continuous technological innovations and improvements to meet our customer needs. Some of the IIL corporate social responsibility projects are adoption of government schools. IIL has adopted 2 government schools in the vicinity of its Karkapatla facility in Hyderabad, which is in Telangana. IIL is providing infrastructure and basic facilities, including the midday meals scheme program there. With a gift meal program in the coordination with NDDB, over 2,500 school children are being benefited with the gift meal program in Telangana and Tamil Nadu. IIL has also donated oxygen generation plant at TIMS Gachibowli. To know more, these are the few key highlights of Indian Immunologicals Limited and Human Biological Institute. To know more about IIL or Human Biological Institute, please visit the website www.indian.com or for channels. Immunize is one of our unique initiatives which vaccination not only but also strengthens immunity. Welcome to today's episode of Conclave. And the session is dedicated to a very highly influent topic, which is adult immunization matters. Protect yourself at every age. It is my privilege to introduce our panelists, Dr. Harmeet Singh and Dr. Srinivas, lead pediatricians. Welcome, Doctor.
Yeah. Thank you for the kind introduction.
Now, before we start the session, let me have a privilege to welcome both of you. My pleasure to welcome. It is my pleasure to introduce Dr. Harmeet Singh, a highly respected oncologist from Ludhiana, with distinguished expertise in digestive and liver diseases. Known for his clinical excellence and vast experience, he has made significant contribution in gastroenterology and advanced endoscopic care. He completed his MBBS and MD in internal medicine from the Government Medical College Patiala, followed by DM in gastroenterology. Harmeet of has special expertise, interventional endoscopy, ESEP, chronic liver diseases, and has invited several prestigious national and international conferences. He previously served as SPS at and is currently Chief Gastroenterologist and Department of Gastroenterology, Deep Hospital, Ludhiana. He is also associated with Society of Gastroenterology, Endoscopy, American Gastroenterology Association, American College of Gastro, and Indian Society of Gastroenterology. So, welcome, Dr. Harmeet Singh. Saluja is privileged to us today. Now, it is again, I take this pride to welcome Dr. Srinivas, a highly respected gastroenterologist and liver specialist. With digestive and liver patient-centered care, he has made significant contributions in gastroenterology and advanced therapeutic endoscopy. Completed his MD and PhD followed by D gastroenterology and holds prestigious international fellowship, including in East US and disorders in Japan and ESEGH in UK. Strong academic and global critical foundation. He is also an international member of the American College of Gastroenterology with special expertise in liver disease and advanced endoscopy procedures. Dr. Srinivas has been committed to advancing digestive health through quality health clinical care and innovation. So, welcome, Dr. Srinivas. It's truly a privilege to have you us speak today. Yeah. We missed Dr. Harmeet. Yeah, Harmeet is back. Yes. So today is a very important topic. What we are going to discuss here is adult immunization, and it matters because it is very important at every age and stage of life. Now we have to meet gastroenterologists today. Dr. Harmeet, I think. With many adults that vaccines are mainly for children. I mean, it's a big understanding among adults that vaccines should be only given to the child
It's not audible.
and the kids,
No.
and it is we don't have vaccines for adults or any age or any stage of life. That's from liver healthcare perspective.
Actually, sir, it is not audible. Voice is breaking.
Okay.
Voice is
Shall I
breaking,
repeat
sir.
the question? Is it audible now?
Yeah, now it's okay.
Yes, sir.
अभी एक बार
Is it
रिपीट
okay?
करना सर, एक बार ना वॉइस ब्रेक हो रही थी आपकी.
Okay, fine. Is it audible now?
Now it's better. Yeah.
Yes.
Yeah.
Can you repeat the
Fine.
question?
So, Dr. Harmeet, many adults, do you have? Is it okay?
Yeah, there is a definite problem with the mic. I think you can address Dr. Srinivas. There is some problem with the mic.
Yes, I'm also feeling the same, sir. In between, your voice is getting cut.
My
Voice is getting
my
broken,
voice.
so we are not able to hear what you
Okay.
are speaking clearly.
Yes, it's Mr. Santosh. Yes.
Yes. Fine. Yeah. Yeah. So, doctor, is it audible now?
No, I think
Yeah.
it's better. Yeah.
Am I audible, doctor?
Yeah.
Come.
There is some noise.
Yeah, now it's pleasant. I think you can start, sir.
Okay. So sorry.
Yeah, please, you can go ahead, sir. We are
Yeah.
hearing you properly. Yeah.
Now it's all, we have removed all the noise, I think. So okay. So to all the viewers, sorry for the technical glitch. So my question for the first for to Dr. Harmeet Singh was, doctor, as you know that in adults today, if you see there is a notion. Just a second, is it audible?
Yeah. Is it?
Yeah,
It is.
it's audible. Yeah, you are audible.
No.
Mr. Santosh,
Just a moment. Just a moment.
you are audible to us.
ठीक है हम ठीक है ऊपर कितने डॉक्टर कौशल का रूम है
Yeah. Yeah. Dr. Srinivas.
Yeah. Yes.
Yeah, fine. Now we are through. So, Dr. Harmeet, the question which we were discussing about, adult have a notion that yes, the vaccines are only restricted to childhood. Now, why does adult immunization matters? And especially if you see the gastro and liver health perspective, why adult immunization is important now?
I think you're very right. Generally, the notion of public is that immunization is for children.
Yeah,
Am I audible?
yeah, doctor, complete.
Yeah. But with the rising incidence of liver diseases like fatty liver disease, fatty liver related cirrhosis, and other chronic illnesses like diabetes,
Yeah.
I think adult immunization should be emphasized and it's recommended also, especially hepatitis A vaccination for patients with underlying cirrhosis or those with conditions like diabetes mellitus or for that matter some immune deficiency diseases or patients who are on IBD, they should be provided with vaccination, especially hepatitis A, and even they should have updated vaccination for hepatitis B also.
Okay. So, doctor, why it becomes critical for this kind this situation, like people who have liver problem or people who have a gastro related issues, why it becomes cumbersome for the patients, or they get affected to the infectious disease more?
Yeah. I think this question is to me.
Yeah.
Yeah, actually, if you see all these patients like patients with diabetes or chronic liver diseases or chronic kidney disease or some COPD patients, they are compared to normal population, they are having some high risk for attaining some infections and that too in a severe form.
Okay.
So before getting the before getting that severity of the disease, I think it's prevention is better than cure. Cure prevention is better than disease treatment. So in that way, they are the high risk people, so they need vaccination and regular booster doses also.
So, as you, Dr. Srinivas said, Dr. Harmeet, is there any scientific evidence that where really this kind of or people are being affected in India or in the world suffering from having these comorbid cases get affected with the infectious diseases?
Yeah, I think there is scientific data backing this. Also, in a real world scenario, we see that, hepatitis A patients, there is resurgence of hepatitis A, and especially it's more severe in adults. So, that thing we are seeing in a real case scenario also. So especially those who are having some underlying chronic liver disease, they need to be vaccinated because they can develop acute on chronic liver failure also. So I think there is scientific data backing this, and real world cases also they show the same.
Now, the same question related to Dr. Srinivas. Dr. Srinivas, as Dr. Harmeet said that about hepatitis A, people are getting infected more. Is there any other disease which you feel it is being affair is which people should be more cautious of?
Yeah, because hepatitis A is mainly through water and food contamination. So likewise, like more like travelers who are frequently traveling to some new places and other like for their job purposes also, they are more prone for food and water contamination. So like hepatitis A, there is typhoid and hepatitis E, and like some like other bacterial infections like cholera. All those things are like more prone for travelers. So they are more prone for people who are traveling. So in that way, like if you are having vaccination for the diseases, so I think it's better for the travelers to get vaccinated before getting the disease.
Yeah. So, apart from hepatitis A, as you know, now we discuss something hepatitis E, hepatitis. Then you have got adult. Even if we are seeing a lot of cases of influenza, do you feel influenza as a disease is also being severe for people having gastro and liver conditions?
Ye- Yeah, I think influenza, it's a like viral infection, and patients who, especially those who are having underlying chronic liver disease like cirrhosis, or for that matter, if they are IBD on immunosuppressive therapy and they are immunocompromised, definitely the viral infection, influenza or viral pneumonia, they tend to have more severe disease and longer hospital course and more complications also.
Right, right. So, Dr. Srinivas, apart from this, gastro or liver conditions, which adults should, especially you think that other conditions where adults should consider vaccination or other illness or any underlying conditions you will like to highlight, which where adults need vaccination, I mean, should consider vaccination as an important prevention for these infectious diseases?
Yeah, I feel all adult population who requires vaccination, they should get vaccinated. Mainly the people work in hospitals or some poultries or some like who are working in prone like infectious prone conditions. I think
Like
they should,
occupational.
yeah,
I'm
occupational exposures. In those people, I think they are the people to get vaccinated as earlier, and even the patients who are having diabetes or other chronic conditions like CLD or CKD, they are the people, and even the elderly people who are more than 60, they should be considered for vaccination.
So, Dr. Hamid, now Dr. Srinivas said that certain conditions like the chronic liver disease or people who are suffering from diabetes, they should be more worried of. So, why diabetic patient considers on such important group to be vaccinated? And which are the vaccines are recommended? You like to recommend for the people who are diabetic?
I think diabetes per se, they have decreased neutrophil function. They have disordered cell mediated immunity, and they have macro and microvascular complications. So they are more prone to infections. And I think we recommend at least hepatitis B vaccination should be updated if they have their titers tested and they have protective immunity, then it's fine. Otherwise, get a booster dose for Hep B and hepatitis A and annual influenza vaccine. I think that should be pneumococcal even. Those are the vaccines that we generally recommend to our diabetic patient population.
So, Dr. Srinivas, mostly if you see hepatitis B, mostly people have taken vaccines. So, do you recommend boosters at some point of time of the age, or if at all, why and how if booster is needed for
Yeah,
hepatitis?
yeah. Boosters are actually needed for uh, like
Yeah, yeah.
Ah, if you see like our titers will get lowered, our antibody titer after a vaccination, it will get lowered over the time course. So for hepatitis B, it's like around 5 to 10 years. I think we should get booster dose repeatedly, depending on our antibody count, the antibody count, titer count, because uh, people who are having chances of exposure, like hospital staff or people living with the HBV patients, like their wife, kids, or some close relatives, I think they should get their titers after 5 years or so. And if the titers are less than 100, they should get booster doses. And for other people, if the titer is less than 10, I think they should get one more shot of the vaccine.
Okay, so that means in future, if anybody who has taken hepatitis B, in some point of stage, in the some point of time in the age group, the age they reach, they should test the antibodies, and if at all the antibodies have fallen, you recommend booster dose for them, right? So. Now, Doctor, we know about hepatitis A. My question is to Dr. Hamid. Dr. Hamid, how relevant is hepatitis A vaccination in adults today, and why it is important for travelers and food handlers, especially, and why it is important for adults today?
I think food handlers, they are more exposed to all kind of maybe contaminated stuff, because we know that hepatitis has a fecal route of transmission, and they can uh, be contaminants for others also. So it's so very important for food handlers and frequent travelers, especially persons who are traveling to areas where hepatitis A is rampant or developing world, or if there is poor sanitation conditions. So those people, they need to be vaccinated with hepatitis A vaccine. So it's very important for them.
Right. So, how it is spread, Doctor? Hepatitis A as a disease.
Fecal route of transmission from contaminated water or food.
So, can this virus transmit from the surface, like anybody through
Yeah, actually, among
contacts?
all the hepatitis viruses,
Yeah.
compared to all the hepatitis viruses, hepatitis A is actually it is having multiple modes of transmission. So
Okay.
even like fecal-oral or some like contamination, like surface contamination, also if it's the titer is more, I think, and the people are like very sensitive. They are the people. There is a chance to get hepatitis A.
Okay.
So vaccination is actually universally recommended, hepatitis A, that too in India.
So, Dr. Srinivas, there is something called hepatitis A. Hepatitis A, is it severe? Very important for the case for the patients for having acute, I mean, having chronic liver disease, or people where liver transplant has been done, or cirrhosis. If at all, why it is important?
If you see, most of the hepatitis A virus infection is like it will get resolved by its own over some time period. If something like if the disease is not like if hepatitis A is not properly treated, sometimes it can cause some permanent liver issues also, and in rare conditions it may lead to ALF, like acute liver failure. So to stop that, I think mostly we should take a gastroenterologist or hepatologist advice, and accordingly we should plan. And the people who are nearby, like their family members, should get vaccinated with hepatitis A, so that the transmission from the patient to attendants will be prevented.
Yeah. Now you have said that the transmission of yes, it spread through contacts, and also we need to spread the I mean the transfer, stop the transfer. So, Dr. Harmeet, if you see the current epidemiology of India, like hepatitis A. Previously, it was said that hepatitis A is already most of the people are get infected during their childhood, but now with the hygiene or the safe practices which we are following, access to clean drinking water and food and hygiene practices, we see that there is a change in epidemiology in India, and many of the children in the adolescent group, adolescent age, are not being exposed to that, and we see that adults are the cases are getting very severe. Would you like to say something, or what is your standpoint on this?
Yeah, I agree with your point of view. I think uh, with improving sanitation, we call it like hygiene hypothesis. So the exposure to hepatitis A virus, that is not happening as it used to happen before. And adults and even I think 20, 21 age group and even uh, higher age group, they are exposed. And in children, the hepatitis used to be anictric, but in adults, we see that enzymes they jump down to thousands, and icterus develops quickly. And some of our patients they had bilirubin up to 20, and one of the patient even had acute liver failure, though she didn't require transplant. So what we are seeing is a shift of the illness from childhood to adulthood, and the hepatitis being more severe. So that is what we are seeing currently. Yeah.
Right. Now, the question to Dr. Srinivas, Doctor, we discussed something called on influenza vaccination. You feel adult require influenza vaccine exclusively people who are in chronic, suffering from chronic diseases, and if at all influenza vaccine needs to be taken, how often they have to take the vaccine, and which chronic categories we should consider influenza vaccine?
Yeah, yeah. Actually, chronic obstructive pulmonary disease patients (COPD), they are having acute exacerbations during the disease course. So mostly they can get severity in monsoon seasons or winter seasons. So before the commencement of these seasons, they should get vaccination with flu. Uh, I think preferably 2 weeks prior to the season, so that they can get good immunity at the time of that acute exacerbation. So that can be prevented, so that we can reduce the disease morbidity and their suffering, and along with that some repeated admissions also. COPD
Right.
patients are the people they should preferably get yearly flu vaccination, and even adults more than 50 to 60 years. I think if their immunity is poor, I think it's better for them to get like what you call inactivated vaccines, not live attenuated.
Okay. So influenza, as you said, doctor, every year it needs to be taken, right? For as per the strain, it is every year the strain changes, and every year we need to take the prick.
Yes.
Or with one shot, how many years we can get protection with influenza vaccine, doctor?
No, actually, what happens is flu. We are having multiple variants of flu viruses. So
Yes.
even you already said that, like there are multiple strains, but even if you take vaccination for a strain, it is like protective for the other strain also. But in a like if you get that infection also, it will be much lesser severity than the people who didn't take the vaccine. So even the even there are different strains also. It's like the flu vaccine will work for the other.
Right. Now, one more important, my question to Dr. Hamid would be like, Doctor, some point of time we discussed about typhoid, and there is one more disease which is very much critical for the adults and exclusively for the people who are of chronic conditions. So that is pneumococcal. So, what are the benefits of pneumococcal vaccination in the chronic illness, and how it is important for the people in the adult stage, and which risk groups you recommend pneumococcal vaccination and also the typhoid vaccination, please?
Yeah, I think typhoid vaccination is important because the adulthood, the patients can develop complications like perforation and sometimes severe bleeding. I've seen a few cases who had severe bleeding which could not be controlled, and the bleeding had to be controlled by doing a hemicolectomy. There was ileal perforation with profuse bleeding. So, typhoid vaccine is important. Similarly, pneumococcal vaccine, especially those who are immunocompromised. I will again reiterate the diabetics and patients with IBD on immunosuppressive agents or CKD patients. In those, the streptococcus pneumonia, if it happens, it can be quite severe, and with its all the complications. So it's important to get pneumococcal vaccine for that matter.
Now, how about the typhoid, doctor?
Yeah, typhoid is actually it is having fecal-oral contamination. So luckily in India we are having conjugate vaccine for typhoid. So and it's if you take it, it will be protective for about 5 years. So we can take booster afterwards. So I think for mainly for the food handlers and for the people who are working in the hospitals, mostly they should take this typhoid vaccine so that it's helpful for them and for the others.
Okay, right. So, doctor, some point of time to discuss something about the occupational thing, which point in our discussion which came up. So, you feel that do you feel vaccine is essential for certain occupational workers and healthcare workers, and if at all, which are the vaccines which is recommended for healthcare workers, and which occupations are bring them to the risk of certain infectious diseases?
Question to me?
Dr. Srinivas. The question is to Dr. Srinivas. Yeah.
Sorry. Sorry. Can you please repeat?
Sir, we discussed something called occupational exposure to the infectious diseases. So we know that there are certain important vaccines which is recommended for the healthcare workers, and also there are vaccines which are recommended for certain category of occupational workers who are at risk. So could you please highlight on what occupational workers vaccinations and which are the key diseases which they should take care of?
Yeah, mainly food handlers and the people working in poultry and those people, I think they are more prone to transmit their diseases to others. So I think they are the candidates to get typhoid vaccination and hepatitis A vaccine also.
Yeah.
And actually, there is a story on typhoid. I think typhoid Mary, because of
Typhoid?
her name
Mary.
typhoid. Because Mary is a lady who is working in some hotel or somewhere.
Okay.
So she once in that area where she used to cook for the people in a hotel in a restaurant. There is an huge epidemic during one point of time. Later, they come to know that because of Mary, who had typhoid, she was the candidate who transmitted the disease to the people over there.
Okay.
So that was that was a history, and it was a good example of how we can prevent epidemic. And if we don't do that, it can lead to lot of monetary or healthcare this thing to the society. So in that way, the food handlers are the prime important for typhoid vaccination, and even the people who are living in the hostels, mainly the adolescents from 12 to 19 years, they are having more chances of hepatitis A because mostly the people who cross more 20 years, they in India mostly all of us we at one point of time we might have exposed to hepatitis A. And even for hepatitis A, the earlier you get exposed, the less will be the disease and even the symptoms also. So in that way, the adolescents people and food handlers, they are the people who get vaccinations for these type of diseases.
Right. So, doctor, you said an example of Mary, right? So, similarly, the if you see the condition of Kerala, like what we have seen last year, a lot many outbreaks, and in a year, some 35,000 cases have been reported for hepatitis A, and we have seen that contamination of both food and water as a reason. We have seen certain outbreaks related to restaurants in India itself. So we have a certain kinds of outbreaks, which because this kind of outbreak can affect a large and mass number of population, as you rightly said. Now, Dr. Harmeet, now when we talk about the preventive care, now we talk about vaccine and preventive care. How do you ensure that this vaccines are being actually routinely used in the practices or health checkups or during your monitoring, like in your day-to-day practice?
So I think it's about education and one-to-one interaction with the patients and their relatives. So in our OPDs, like when we see the patients of chronic liver disease, we guide them that they need to be vaccinated at least for hepatitis A, and because they have these chances of acute or chronic liver disease, which can have its deleterious consequences. So I think it's one-to-one interaction with the patients and their relatives and their counseling, which plays a very important role for this strategy to work.
So, Dr. Srinivas, how do you take it? Like in terms of how adults discuss this kind of vaccination needs with gastroenterologist, or you don't have any kind of patient who comes to gastroenterologist or liver disease, do they discuss from their side any vaccines which is essential, or how the condition is now?
Yeah, I think previously they were most of the people they are unaware of this, but recently because of the Google or some other platforms, they are come to know about this. But most of them they are not okay for the vaccination.
Aware, I think awareness, doctor, is there, or they are not okay with the vaccination.
Yeah,
How it
because
is?
of the side effects, what they think, and for the cost also. But usually they are cost effective if you compare, because once if they get the disease, that is more costlier than the vaccine. But
Yeah,
that,
but what we have seen, doctor, as you said, it is the disease in gastro and liver are very costlier. Like anybody who gets a kind of disease, they get admitted for longer period of time, and the hospital burden is very high. The burden of the health cost is too high for the patient, for the family. And if we routinely practice, like is can it be incorporated in the routine practice, like when we see that for as a child, like we have immunization guidelines that the child takes birth, he should take vaccine. Now for an adult, when we go for, right, we go for routine checkup like blood test, I mean the weight, the BMI and the height and weight and the blood test we do. So we always do you feel that there is a need that certain vaccination record also needs to be tick marked for during our practice?
yeah, actually we are practicing for IBD patients because
Yeah.
they are candidates we regularly see, and they are the patients they stay for years together. So even the CLD patients also, their vaccination schedule, we should give a vaccination chart so that they should get ticked once they get the vaccination. So that's a good idea. I think for the liver patients also, it's a like it's a nice thought to make a vaccination chart for them, like what we do for IBD.
Yeah. So now, since we are coming up with a fantastic discussion, now we have to give a message to the public, doctor. So for Dr. Harmeet, if every adult viewer takes a preventive action after today's discussion, what should be the first step from your side?
First step, okay.
Yeah. You want to give a message to the people who are actually are being viewing this video or video live talk, so a message to the public what should be that what preventive steps they should take uh, if they have some chronic conditions.
So I feel it's the right time to shun the fear of vaccinations. So I think that there are two things. One is the cost, and second is the fear of adverse effects. So if we talk of hepatitis A vaccine, or for that matter, the other vaccines that we talked about, there are minimal side effects only.
Yeah.
And I would urge them to come forward and get themselves vaccinated, especially if they are in high risk category. So
I think,
I think
Doctor,
that
how do you
that's my
say?
message.
Yeah. So, Dr. Srinivas, how do you say about the safety of the vaccines which we discussed today, whether it is hepatitis B, hepatitis, or typhoid, or pneumococcal? We discussed so many important vaccines today. So, how do you feel that? How is the safety of these vaccines?
Yeah, because most of the vaccines are safe because they have to pass through the 5 phases of trial before commencement into the market. And mostly, if you take the vaccine also, mostly the side effects are milder, mild fever and some form of rashes, something like that. But that too, it's like it will resolve spontaneously over 24 hours. And that point we should tell to the patients so that there will be no much fear in taking vaccination. So because the symptoms, the side effects are very mild. So in any of the vaccines, I think they can be easily taken in subcutaneous or IM form. So compared to like a lot of vaccinations previously, they used to have like anaphylaxis, all those things. But nowadays we are not getting those type of complications. Mostly the side effects are very mild. That should be emphasized to the patients.
Yes. So we have these vaccines are well established, and we have better track records for this vaccine, and it has been established from the childhood as well as in the adults. So before we wind up this session, I would like to have what adults should do, especially for those who are a diabetic, liver disease, and high risk conditions. What they should do know about protecting themselves from hepatitis A and B vaccination. Dr. Harmeet, first you can share, and then Dr. Srinivas. Yeah, please, your thoughts.
I didn't get your question. Can you
The question
repeat?
is, Doctor, especially people who are diabetic or having chronic liver diseases or any other high risk health conditions, what they should know about protecting themselves of hepatitis A and B. What should be your message for them?
I think my message is that they should follow universal precautions. uh, Hepatitis A, the fecal-oral route, so safe drinking water. And for hepatitis B, the message is that the universal precautions should be followed. Yeah.
Right. Dr. Srinivas, your message, please.
Yeah, the correct time and the correct dosage is of more importance, is of much importance in these type of disease prevention, because hepatitis A or B, if you take for children, it should be 0.5 ml, and for adults, it should be 1 ml. So that dosage should be like it should be well practiced, because what happens in most of the situations, even adults also, they are getting childhood dosages in most of the places. So that should be taken care, and even the people who are in close contacts with the deceased patients, they should be they should get more awareness about these hepatitis A and hepatitis B vaccination.
So thank you all for being a part of Immunize Conclave, and we hope today's session was informative and valuable in spreading awareness on adult immunization matters. Protect yourself at every age. Our special thanks to Dr. Harmeet Singh and Dr. Srinivas for sharing their time, expertise, and insight with us today. For those who would like to revisit the program, the video will be available on our official social media platforms. Please follow us in the social media channels. Do like, share, and spread the word as many includes you, including your friends, your family, and relatives. Until we meet in our next live talk, stay healthy, stay aware, and please do take good care of yourself. Thank you so much, Doctor.
Thank you.
Thank you.